So maybe you just did a leap or a jump and you landed the wrong way, or maybe you turned and twisted your knee weird. Basically, if you're watching this video, it's probably because something doesn't feel right. What is up, you guys? My name is Gaylyn Lareese. I make dance-related content here on my channel, lots of dance tips, and this video is one of them. Recently, I did a video on healthy habits, and I kind of just outlined some things that you can do as preventative measures to make sure you don't get injured unnecessarily. But unfortunately, sometimes things happen and things can get out of your control, and so you need to be prepared and know what to do when that time comes. I'm going to start off this video mostly talking about things that have to do with finding a doctor and all of that stuff, because that's usually the stuff that people don't know, and then I'll backtrack later and talk more about how to actually take care of the injury before you're able to be seen by a doctor. So the first question that you're probably asking yourself is, how do I even know if this is something worth seeing a doctor for? One, if you have a pain that happens immediately after doing some kind of movement or making some kind of impact. So if you land and immediately afterward you feel pain in your knee or in your foot, that means that it's probably some kind of impact-related injury, and so you want to get it checked. The second thing is if you have noticed that over time, continuously going to classes, the pain that you're having consistently persists and even starts to get worse over time and impacts how your dancing is actually evolving and progressing. Obviously, if you have a pain that is causing you to not be able to dance your best, it's probably time that you should get it checked out. And so that's one way to know, okay, it's time to see what's going on. The third is if you are around your puberty age. Around this age, you're having a lot of different growth in your body, in your joints, and so sometimes you are going to have pain simply from just growing, but those pains from growing can also be impacted by how your joints are getting used on a day-to-day basis. And if you are dancing on a day-to-day basis, then it's going to impact how your body grows. So that's also a reason why you might want to get checked out by a doctor. Okay, so now that you've decided I'm going to get checked out by a doctor, what you're probably asking yourself is, what kind of doctor am I supposed to see? And that is my second tip, which is I want you to see an orthopedic specialist. When you are young, you probably have a pediatrician who you are used to seeing, who probably has a really good idea of your medical history from birth. And those are really important doctors, especially in your young age. But it's also important to have specialists because the cost of medical care in this country is not cheap, and you can risk wasting your money going to see a general practitioner when in reality what you need to see is a specialist, especially if it has to do with some kind of bone or joint or muscular pain. If you do not know an orthopedic specialist, you can go about finding one in a couple of different ways. The first way is to simply ask your primary care doctor if they have an orthopedic specialist that they would recommend. A lot of times the doctor, medical world, you can tell I'm not a doctor just because I'm like, doctor, medical, I don't know the terms, but a lot of times they often know each other, they run in the same circles, and they may know someone who they would probably recommend for a specific issue. Now, outside of orthopedic specialists, there are specialists that work just on ankles and feet. There are specialists that work just on your back. And so depending on where you're feeling this pain, that's going to decide what kind of specialist you are looking for. But if you're having pain in your hips or in your knees, which is often what you're going to feel if you're a dancer a lot of times, I personally go to an orthopedic specialist first. Now, another way that you can find this doctor is actually by going to the coaches on your school's athletic teams and asking them if they have doctors that they would recommend. These coaches are very invested in their players, as they should be. And so oftentimes they know different specialists who they send their players to, who are used to working with younger adults or adolescents who are pretty athletic and practice whatever their skill is on a repetitive basis. And having someone who kind of understands what that more physical, active lifestyle is like is really, really important, because you're a dancer, and although you may not be an athlete, you also may, we don't do one thing, we are not monoliths. You do put out just the same amount of work as they do. And so you want someone who is used to that level of high intensity. Now, the third way that you can find an orthopedic specialist or a specialist for the particular region that is paining you is by doing a Google search. Now, when you're doing this Google search, obviously you want to find doctors that are in your area, but you also want to deeply be looking at the reviews. What are other people who have gone to them saying about them in terms of their bedside manner, in terms of how well they explain what the issue is that you're having? There's all kinds of things that can make a doctor not the best experience. And so by taking a look at those reviews and really seeing what types of clientele come in and also what their experience has been like will help you decide on one that is the best fit for you. A lot of these doctors are also working with the elderly. A lot of them often work with people who have hip replacements and all that kind of stuff too. So keep that in mind, that a lot of these reviews you're gonna see are probably gonna be people who are a little bit older. But again, looking for a doctor who has experience working with someone who does some kind of repetitive athletic practice will make sure that you find someone who's going to be a good fit for you. Now, sometimes, depending on which insurance you have, your insurance provider may actually require you to see your primary care doctor first, and actually they may require you to get a referral in order to see a specialist. That depends on your insurance. So when it comes time to make this decision, make sure you give them a call first and understand what kind of procedures they have for seeing specialists. Sometimes they make you have a higher copay if it's a specialist versus if it's just a primary care doctor. So take a look at all of that stuff first, so that there are no surprises when you go and make your appointment. Okay, so now you probably have your doctor's appointment set up, and the third thing that I want you to keep in mind is that during this time when you are waiting for your doctor's appointment, you want to really focus on your pain so that you can properly communicate what's actually going on. We think that doctors can be miracle workers and that they know everything, but they see so many people in a day, and they can sometimes become a little jaded from time to time. And so it's important for you to really be able to advocate for yourself and communicate what's going on. Things that you want to be able to explain are the location of your pain. So where are you feeling it? If it's in your knee, it's not just in your knee. Is it on the inside part of your knee, on the outside part of your knee? Is it behind your knee? Really, in this time where you are probably sitting and resting and not dancing as often, this is your time to make it your job to understand your pain. The second thing you want to be able to do is actually explain how your pain feels to you. Pain is a very general term for essentially intense discomfort, but there are many different types of pain that your body can feel based on what's actually going on with your body. So some words that you might want to use to describe your pain are stinging or burning or sharp. Sharp pain is going to be something that's more intense in one localized area. Burning pain, if that's what you're feeling, can often be attributed more to a nerve-related issue. So if you're feeling burning pain, that often will give a doctor some kind of insight into maybe there's nerve stuff going on. Again, I'm not a doctor, you know what I'm saying? Just your big cousin that dances. But another word that you may be using is throbbing. Does it feel like there's a throbbing happening in the area where you're feeling pain? Does it feel like something is popping? Does it feel like something is pulling? These are all words that you want to use so that you can be more descriptive instead of just saying, this hurts here. The third thing that you want to really think about when trying to communicate your pain is when it feels painful and when the pain is relieved. So, for example, if there was something wrong with my elbow, I could tell my doctor, my elbow hurts when I extend it, but when I relax my elbow, it doesn't hurt as much. That's going to give them more information about what could be possibly causing the issue. So take note of when the pain is the worst, when the pain during the day also feels the worst. So it could be during the day during daylight hours, it feels fine, and then at night, it starts to pain a little bit more. But also, when does it feel okay? When is the pain alleviated? Is it ever alleviated? These are things to keep in mind, as well as if you are taking some over-the-counter meds like NSAIDs for inflammation or things like that, giving them an idea of how often you're taking that as well. So now you've done your research on yourself, and it's time for your doctor's appointment. Now, when you walk into the doctor's appointment, you want to automatically make eye contact with the doctor, and often they will shake your hand or greet you. You want to make sure that they can tell that you want to be involved in your own care, even if you're young. This is something that's going to also make them come a little bit better. When you're more passive, it's going to rub off on the people around you, and you want to show them that you're really serious about what you do. Maybe you're really serious about dance, and so this injury is something that you are also serious about. Now, if you're like me and you have a pain and you go to the doctor, you probably have tried to Google diagnose yourself, and I'm not going to say that anything is wrong with that, because honestly, sometimes you got to do a little research. But if you have done research and there are things that sound like they kind of make sense to you, or they sound similar to the kind of pain that you're having, that's something that you want to bring up to your doctor. You could tell them, I have pain here. I've noticed this pain is worse during this time of day, and it kind of hurts a lot when I, do this to my body part or do this. And I've been looking it up, and I feel like based on what I'm feeling, I may be dealing with blank. This shows the doctor that A, you have been noticing what is going on, you've been attentive to what has been going on, and even if you're incorrect, sometimes it can give them just a good place to start. And if you are incorrect, they can reassure you, actually, that's probably not what this is. We typically see that with, XYZ. At this point, they'll probably do a couple of tests on you. They'll try and test when things hurt and when things don't. And from that point, they may tell you if they are going to get imaging done. Now, when I say imaging, I mean medical imaging, so MRIs, X-rays, things like that. I personally prefer, especially if you have never been to an orthopedic doctor before, or you've never had some kind of dance injury before, to request some kind of imaging be done if they don't suggest that you need it. It's also good to request imaging, especially remember how I said if you're in those preteen, puberty years, because you may also have things going on in your body that you honestly aren't even aware of. People may have scoliosis that they aren't even aware of because it's so minute, which could be impacting how they walk, which could be impacting how you dance, which could be impacting why you have an injury. Or, certain things like breast development can change women's backs. A lot of young girls, if they do develop breasts quicker, it does impact their musculature and their bones in their back. So that's why I highly recommend, if you have not had any kind of X-ray, MRI, any kind of imaging done, that you get it done, even if, you're not fully sure if it's necessary, just so that you can kind of know where your baseline is. And if you are denied imaging, ask them to document on your chart that you requested imaging be done for your injury and were denied. This does a couple of things. One, a lot of times doctors will just be like, okay, we'll get the X-ray. And it kind of makes them back down a little bit because they don't want to get in trouble later for not having, done all of the checks that they need to do to make sure that they are assessing you the correct way. This also will help you if you choose to go get a second opinion, just so that you can show that this was something that I requested and was denied, so that the doctor, instead of relying off of what the first doctor said, will know that they need to do their own research and their own imaging, and hopefully you can kind of get a doctor to listen to you at that point. As someone who, I'm Black, I'm a woman, sometimes doctors, not all the time, I've had some really amazing doctors, but sometimes they act like they don't want to listen to me, and so, sometimes you gotta say what you need to say. Also, something else you can do in terms of just alleviating any worry, if there is something that you may be concerned that you have going on, a great way to word it is to ask your doctor, hi, I have noticed I have these pains. I'm thinking it's this. Is there anything that you would typically do to rule that out, just so that I could feel better about that? A lot of times doctors won't tell you openly, like, oh yeah, we would do a blood test, and we would do this, and we would do that. And so sometimes you have to actually ask them, how would you rule this out? And then ask them to do that. So there are a lot of different ways that I've learned over time just to show doctors that you are advocating for yourself, that you're interested in your recovery, and that, you know, you want the best care possible. At this point, your doctor may recommend a couple of things. There may be a situation where you have to possibly wait and see what the imaging says to know if surgery is necessary, or, you know, if further steps need to be taken. If surgery is not necessary, something that you may have to go through is physical therapy. Now, as someone who has gone through physical therapy, I think 3 times, I love it. Every single time I get physical therapy, I come back so much stronger, and it's truly a learning opportunity for you to get to know your body. I feel like a lot of dancers, we know our body through dance and through what other people tell us about our bodies, or maybe what we see just physically in a mirror. But to understand how your body works, sometimes you have to have someone to truly explain how these joints and muscles and connective tissue all work together to help you function. And so your doctor may recommend that you go get physical therapy, and if your insurance covers it, or if you are somehow able to swing at least 3 sessions, I highly recommend you do so. This is because physical therapists will often give you a number of exercises to do at home. They will give you homework, and once you have gone a couple of times, let's say maybe you aren't able to get more appointments, or your insurance can be really restrictive in how many appointments you get, at least you have those starting points, those exercises that you can do, and you can do those even when you're not seeing a physical therapist. Again, I would recommend seeing someone who's used to working with athletes. I, in the past, have had physical therapists who've worked with basketball players and football players, and they honestly have been some of the best people in my life in terms of me keeping my body up, because they truly understand how rigorous, you know, our practice is as dancers. And a lot of the stuff that they see can be applied to dancers. Sometimes we have weaknesses in spots that maybe basketball players don't, or football players don't, and so those things become very, very obvious to them because they're used to seeing strength in a specific place or seeing weakness in a specific place in football players or basketball players or whatever. And so, you know, like I said, if you can find someone who's used to working with athletes, please go for it. So now that we've covered all of the doctor and physical therapist and visit stuff, let's talk about what you should be doing at home. The first thing is, if you are having some sort of pain that is truly, you know, aching you while you are dancing, please sit down. Do not push yourself to the point of where you're, you know, what is it, grimacing? Is that what it's called? When your face is like, you know, and you're trying to push through class and you're like, I love dance, and it's not that deep. It is, but it isn't, you know what I mean? And so it's much more important that you preserve your body until you figure out what exactly is going on with it. I highly recommend that wherever you're having pain, ice typically works as a good way to kind of alleviate pain in the beginning when you aren't really sure exactly what it is. There's so many different, you know, ice versus heat, and I feel like every 2 years it changes, but generally for me, I like to do ice. Having ice on for roughly 15 to 20 minutes and then off for 30 minutes to an hour will help you so that you can kind of keep some inflammation down a little bit while you're trying to figure out what's going on. The next thing that you want to do is make sure you are stabilizing wherever you're having that pain. So if you do have a sprain or a pull or a tear sometimes, those things can be further exacerbated by unnecessary movement. So if you can wear some sort of brace, some sort of sling, some sort of something to keep that in position while you are waiting to be seen, I highly recommend it. During this time, especially if it's an injury on your lower extremities, you want to make sure that you are also elevating whatever that body part is. And bonus points if you can lay down on the floor with your legs up, if it's like an ankle or a knee or something like that. The reason why this is so good for your body is because it helps kind of circulate blood flow through your body, and nutritious blood is what's going to help anything heal. And so you want to make sure that's circulating and not kind of settling and pooling, and it kind of tends to when you're standing because of gravity. So reversing yourself, inverting yourself helps that blood flow to alleviate swelling and also try to start that healing process a little bit. The last thing that I want to remind you guys to do is to eat really nutritious meals during this time, especially if you think it's some kind of muscle pull or strain. You really want to make sure that you are intaking a lot of protein and just nutritious foods, because these are the things that are going to help your body heal faster. And I'm telling you, every time I pull or sprain something, making sure that I increase my protein intake has always helped it heal so much faster, because my body's using that protein and those amino acids in the protein to build muscle. And I've kind of talked about that a little bit in my flexibility video, so I'll link that for you guys down below and up top in case you want to check that out. But that's why proteins are so necessary, because they help you rebuild muscle, especially if you're trying to repair something. And that is it, you guys. Those are my quick little tips when it comes to injuries. Make sure that you are truly advocating for yourself, because sometimes people fall through the cracks. You know, nothing is perfect, no system is perfect. And so you want to make sure that when it comes to it, you're doing as much as you can to make sure you're getting the help that you need. Obviously, if you're not new around here, then you know that I just am super passionate about dancers really building relationships with their bodies to help them become better dancers and people. And so that's why conversations like these, I think, are really important to me, just because, you know, we got to help each other out. Unfortunately, like I said, I'm not a physician, so I can't really give you help with any specific aches and pains. So hopefully the information in this video has been enough to kind of give you a starting point to help you find the best solution for you. If you enjoyed this video or found it helpful, please give it a thumbs up. This video is also not only for my dancers, but for my dancers' parents, because I know you guys are also dealing with, you know, some things that you may not really fully understand. And so as your dance big cousin, it is my job to kind of help you as much as I can. So I hope this video was helpful, and if you enjoyed it, please consider subscribing. I will see you guys in my next video next weekend. Later.